welcome to another episode of Sleep Talk. Okay, who do we have here with us today? Yes, it's Dr. Han again. Okay, Dr. Han Juan is from the ENT Voice and Snoring Clinic. Hi, Dr. Han.
Hi, Michelle. Nice to be back.
Nice to have you back. Yeah, we really appreciate this. Okay.
My pleasure.
Okay, so for today, I think the last round we spoke about the different treatment options, right?
Yes.
And surgery was one of them.
Yes.
And I think surgery is something which a lot of patients tend to be very tempted to take, right? The surgery option because it's a one-off and so I think I'd like to find out more about surgery options.
Sure.
Okay, so maybe we start off with the types of surgery for obstructive sleep apnea.
Yeah. So broadly speaking, there are three big categories of surgery for sleep apnea. One would be, the most common would be soft tissue surgery. For instance, we clear your nasal passages, we take out your tonsils, we kind of maybe reduce some of the structures in your upper airway to create more space. The second big group would be what we call skeletal surgery, where we would actually increase the dimensions of your upper and lower jaw by changing the upper and lower jaw's bony morphology. And that is also something that's been done for years for sleep apnea, as pioneered in the States, of course. And then the third category, which is fairly recent, is a surgery that is targeting muscle tone during sleep. And this surgery is known as the hypoglossal nerve stimulator surgery. So what it involves is a pacemaker-like device, which will stimulate the nerves that supply the muscles to the upper airway. And when you sleep, when your muscle tone reduces, this device will then increase the muscle tone to keep your airway open. So broadly, these are the three kinds of surgeries that we do for sleep apnea.
Oh, that's interesting. Okay, so, we always, when we ask patients who have been diagnosed with sleep apnea and who have spoken to the doctors about surgery, we realize that different patients actually get different responses pertaining to their success rate.
Yes.
Is there any reason why? Is everyone's success rate different? Or what is this success rate based on?
Yeah, I guess one of the main reasons for differing success rates that are being quoted is because there are so many different kinds of surgeries that are done for sleep apnea. So for instance, every patient is unique. And so the surgery has to be tailored to the patient. It can't be a cookie cutter situation. So for instance, if you have a deviated nasal septum, or if your nose is really blocked, then you definitely need to do nasal surgery. If your tonsils are big, then your tonsils need to come out. If, let's say, for instance, the back of your tongue has a lot of extra tissue that needs to be removed, then that needs to be addressed as well. So when you have so many different kinds of surgeries, the success rate really depends on whether or not these surgeries that are done are the ones that are tailored for you. So for instance, if you don't really have a blocked nose and you end up with nasal surgery, that's not going to really much affect your sleep apnea. It's not going to improve it. So I would say that if you end up with what we call multi-level sleep surgery, where let's say if you're found to have obstructions at many levels in your upper airway, and we deal with that, well, the data suggests that the success rate is in excess of 70%. And this is fielded from many different studies all over the world. But if you just do the nose for a patient who has multiple levels of obstruction, then of course you can only expect the success rate to be much lower because you're not addressing all the areas that need to be addressed. So I think because there are so many different kinds of surgeries that can be done, and of course the expertise to do these surgeries also vary. So I would say that, that kind of explains why so many people are given so much differing information.
Right. So when we talk about success rates, what are we looking at? Does it mean if I go for this surgery, if you tell me that there's a success rate of 70%, means that, well, there's 70% possibility that I'll be cured for life?
Okay, so unfortunately, no.
Oh.
Yeah. So as I think in our last discussion, we did mention the fact that muscle tone during sleep is a very big part in causing sleep apnea. So you can imagine that as a person gets older and older, that the muscle tone would start to drop. Like for instance, if your muscles are not going to be the same when you're 20 as when you're in your 60s. So, surgery, very much like all the other treatment options, is really to reduce the severity of your sleep apnea so that you no longer have symptoms or it no longer poses a health risk to you. So when we say like 70% success rate, that means that we will basically be able to bring you down to a level where the sleep apnea is no longer that symptomatic or it no longer poses a health risk for you. And that would be in 70% of the cases that we do the surgery for. Yeah.
Right. Okay. So just curious, have you ever come across any patient where you felt that there would be 100% success rate?
Yeah. So a lot of patients with very, very large tonsils or very, very blocked nasal passages who have mild or moderate sleep apnea. When we look at the amount of airway narrowing caused by either the tonsils or the nasal obstruction, then we are pretty confident that when we do the surgery to relieve them of these obstructing lesions, that we will achieve a very good success rate, if not a cure. For some of these patients, I can even kind of predict that we will be able to cure them. So if you have a very narrow airway caused by particular structures that can be surgically dealt with, then the surgical success rate actually increases.
Right. Okay. So for example, what if you tell a patient that success rate is very low, but the patient insists that he still wants to go for the surgery?
Yeah. So I would say that the patients whose success rate is very, very low are either you are very much older, okay? So conventional surgery like soft tissue surgery or bony surgery, skeletal surgery, they only address one thing, which is airway narrowing. Things like muscle tone during sleep is not addressed by these conventional surgeries. And so, you can imagine that if your muscle tone is very poor, then it's not going to really benefit you. The other thing is, if you are very, very overweight, let's say if your body mass index is above 40, then because of the fat deposition in your upper airway, surgery is not going to be able to deal with the airway narrowing that's caused by the generalized deposition of fat in your upper airway. In which case, then, surgical success rate will be very, very low. So for these patients, I don't recommend surgery for them. But if they have tried all other kind of avenues for treatment, then you know what? We might consider surgery only if everything else is exhausted and if the patient is able to reduce his weight. Because as doctors, we shouldn't be advocating surgery for patients that we know it's not going to work. Now, because of the new advent of this new kind of surgery called a hypoglossal nerve stimulator, it opens the door for a lot more patients to get treated for sleep apnea through surgery. These are the patients who have failed previous surgical management because the muscle tone issue has never been addressed in them. They simply had airway narrowing addressed, but that wasn't enough. So I would say that, things are looking up for the surgical management of sleep apnea patients.
Right. Okay. That explains, because we've heard patients saying that they were told by their ENTs that they cannot go for surgery because they are too overweight.
Yes. Yeah.
Okay, so that's why.
Yeah.
All right. Oh, and we've also heard that some patients have been asked to use the CPAP
Yes.
after surgery.
Yes.
So, why is that so? Like, why will they need to still use the CPAP after surgery?
Okay. So there are a few scenarios that you would have patients using CPAP after surgery. So one scenario is, let's say if the patient is really very overweight, or even obese. Let's say his body mass index is more than 40. But unfortunately, his nose is also blocked. So the surgery is done to facilitate the use of CPAP. So for instance, like if we clear your nose and that will allow you to use CPAP more comfortably and effectively, then that's what we should do. Another situation would be patients who we know that they will benefit from surgery, but they are not going to be completely cleared with just surgery alone. Like for instance, there are some patients that we know have very large tonsils, but they have also a more complex form of sleep disordered breathing. For instance, they have central sleep apneas mixed up with obstructive sleep apnea. Then yes, removing the tonsils will help with the obstructive sleep apnea, but it may not help with the central sleep apneas, and therefore, treating the obstructing problem as well as treating the central sleep apneas may be a scenario that these patients might, require to be instituted for their overall management. So there are scenarios, but I think I would like to say is that every patient with sleep apnea is in a way different and unique, and the treatment should be tailored towards that particular patient. No two patients are alike, and therefore when we approach the surgical management of any patient with obstructive sleep apnea, then that has to be a bespoke, tailored approach, because not all the patients are going to be cured with surgery, and not all the patients require surgery. Some patients may require a bit of surgery and then CPAP. Some patients may require just surgery, or some patients may require just CPAP. So we all have to look at every patient and decide what's best for him. Yeah.
Right. Okay. Thank you, Dr. Han. I think what you shared today was very useful because we often see patients who will say, no, I don't want CPAP, I want to go for surgery because it's convenient, it's a one-off. So I guess what you've mentioned today, makes people rethink if they're very adamant on doing surgeries, that the outcome may or may not, right? May or may not be as what they expected. Am I right to say that?
Well, I would say that the first port of call for anyone with moderate or severe sleep apnea would be to try CPAP. And if you agree with CPAP, then, just stick with it. Surgery is usually offered when patients are intolerant or incapable of using CPAP devices. And, really, if you are unable to tolerate CPAP, after giving it a good go, then we still have to help you. We can't leave you alone. We can't let you just suffer the consequences of sleep apnea without helping you. So surgery is something that over the years we have been using as a tool to help patients to overcome sleep apnea if they are unable to tolerate CPAP. So I would say give CPAP a good go, and if you are unable to tolerate it, just be mindful that yes, there are other options, but your options may not be the same as another patient or a friend of yours who has gone through a process. Every patient is different. Every patient needs to be kind of like worked up and assessed as to what is the appropriate course of action in terms of surgical management. Yeah.
Yeah, that's a very good reminder, because I think the reasons why patients come forward and sometimes express that they want surgery is because they have seen someone else benefit from surgery, right?
Yeah.
So I guess, yeah. Okay, so that's all we have for today. Thank you very much once again, Dr. Han.
Yeah, no, you're welcome. My pleasure.
Okay, so if we need more help or more answers from you, yeah, we'll come back to you, yeah?
Sure, no an issue. Thank
Okay,
you.
thank you, Dr. Han.